My name is Ronald Go. I'm one of the hematologists here at Mayo Clinic, Rochester, Minnesota. Thank you for your interest in our article entitled Making the Case to Study Volume Outcome Relationship in Hematologic Cancers. For almost 40 years now, we know that in uncommon or complex surgeries, for example, cancer surgeries, the volume of procedure is associated with the clinical outcome, whether it is mortality or postoperative complications. However, studies into the volume and outcome in the medical management of cancers, in particular hematologic cancer, has been either limited or unavailable. In this article, we explore the current literature with regards to volume and outcome relationship in hematologic cancers. We were not able to find much published to this date. We also provide compelling reasons why such volume outcome studies need to be done, and also the potential complications in terms of practice and education. Here I will provide three major reasons why we need to do such volume outcome studies in hematologic cancer. First of all, hematologic cancers are relatively rare and are becoming more complex to diagnose and treat. In 2015, it is estimated that there will be 1.7 million new cancer cases in the U.S., and 10% of these will be hematologic cancers. Similarly, 10% of the cancer deaths in 2015 will be from hematologic cancers. Despite being only 10% of all cancers, hematologic cancers are complex in terms of classification and also management. The World Health Organization provides over 100 subtypes of hematologic cancers, and various research groups have provided different risk stratifications for various hematologic cancers. Similarly, the risk stratification for hematologic cancers are very complex, as you can see on this slide. We generally employ risk stratification in order to help us determine patient-specific therapy. The second reason is that there is an increase in the number of new agents approved in hematologic cancers, and also there is a lot of new clinical practice guidelines published. For example, in the 10 years spanning 2003 to 2014, the U.S. Food and Drug Administration approved 54 new drugs for cancer. 40% of these new drugs are approved for hematologic cancer. Out of these 21 new drugs for hematologic cancers, several are first-in-class type of drugs, meaning they have unique toxicities and unique mode of administration. Therefore, the learning curve in knowing how to use these drugs and manage their complications can be steep. The National Comprehensive Cancer Network publishes clinical practice guidelines for cancer care. There are currently about 43 practice guidelines. 1/4 of these are for hematologic cancers. This is an understatement because for non-Hodgkin lymphoma alone, there are 18 sub-guidelines. This shows the complexity of managing hematologic cancers. Finally, most hematologic cancer patients are treated in the community setting and by physicians with relatively less experience in these diseases. The information from the United States National Cancer Database show that approximately 2/3 of patients with non-Hodgkin lymphoma and multiple myeloma are treated in the community setting. About 1/3 of patients with acute leukemia are treated in the community setting. One can calculate the average number of new hematologic cancer cases seen annually by hematologists, oncologists in the United States, based on data provided by the American Cancer Society and also the American Society of Clinical Oncology National Census. It is estimated that in 2015 there will be 27,000 cases of acute leukemia, a similar number of new myeloma cases, and 72,000 cases of non-Hodgkin lymphoma. Assuming that there is about 13,000 hematologist-oncologists practicing in the United States, on average, each hematologist-oncologist will see only 2 new cases of acute leukemia, 2 new cases of multiple myeloma, and 5 new cases of non-Hodgkin lymphoma annually. These numbers are small. Thank you for your interest in our article. I hope that this will provoke interest and discussion in the topic of volume and outcome relationship in hematologic cancers.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.